So guys, in the neuroanatomy, we first will start with the general part concept of neuroanatomy. In this portion, we will be looking at some developmental part. We'll see the brain vesicles, how the neural tube gives rise to the brain vesicles, which we can divide into the primary, secondary and tertiary brain vesicles, and then there are further divisions also, and what exactly they will give rise to. So a little bit of general neuroanatomy before we go to the neuroanatomy region wise, starting from spinal cord and all the way to cerebrum. So the neural tube, well, we talked about the neural tube in head and neck also when we said the neural tube will divide into the alar plate and basal plate by the sulcus called as the sulcus limitans. But this time we are looking at a neural tube in the more cranial part, and that neural tube in the more cranial part will give rise to the brain vesicles, and we call it the primary brain vesicles. Primary brain vesicles. So you see a sort of dilatations in that, the regional dilatation in the neural tube, which are called as the primary brain vesicles. So like this is the one, we've got the first one here, the second one and the third one. Now what these brain vesicles are named as, guys, these brain vesicles are called as the prosencephalon. We call it prosencephalon. This one here is mesencephalon. And the one which is present below here is a rhombencephalon. Rhombencephalon. Prosen, mesalon and rhombencephalon. This being a primary brain vesicle, there is a further division of this, and the primary brain vesicle will further divide, or you can say subdivide, into the secondary brain vesicles. So the prosencephalon will divide into the telencephalon. Above that you can see there's a telencephalon and diencephalon. So these are the two further divisions of prosencephalon, that is telen and dien. Let me just name them first. That is the telencephalon, and this here is diencephalon. So that's the cranial-most part of the neural tube, which is forming this first dilatation called as the prosencephalon, divides further in two parts, or you can say the secondary brain vesicles. These were the primary, now we're looking at the secondary brain vesicles. Mesencephalon is the only part which will not divide further. So mesencephalon will stay as mesencephalon only. That is the mesencephalon. And rhombencephalon is the one which again further divides into two. We call it metencephalon and myelencephalon. The two further divisions of the rhombencephalon will be the meten and myelin. Right, just highlighting them so that you remember which one is dividing into what. So mesencephalon, as you can see from this diagram, you can make out that the only part which is not further subdividing is mesen. Rest prosen and rhomben are dividing into the secondary brain vesicles. Now they might ask you a question directly from what primary brain vesicle will give rise to, or maybe a more precise question, what secondary brain vesicle gives rise to. So you can go in a sequence and can start thinking from the telencephalon only. You can see telencephalon, they are divided in two parts, which gives an indication of the two cerebral hemisphere only. And that is what? The telencephalon part will give rise to the cerebral hemisphere. This will give rise to the cerebral hemisphere. Cerebral hemisphere. And not only cerebral hemisphere or cerebrum, also the corpus striatum. The corpus striatum. Right? The basal ganglia part, that corpus striatum is also from telencephalon. Diencephalon, guys, when you say the word diencephalon, we think of the entire thalamic family. Thalamus, hypothalamus, meta, epi, subthalamus, they all are derived from the diencephalon only. So this will give rise to the thalamus, to the hypothalamus, to the metathalamus, to the epithalamus, to the subthalamus. So they're all from where? From the diencephalon. And then come meson, meton, and myelencephalon. Now, if I just want to add something to diencephalon here, as I said, thalamus, hypothalamus, and looking at this hypothalamus, you can also think of something more, some extension of the diencephalon, and those extension would be what? Extensions like optic stalk. Like optic stalk is something which will give rise to the optic nerve and retina, which is again coming from the diencephalon only. And then if you look downward, there is an extension that is neurohypophysis, the posterior pituitary, that is also extension coming from the diencephalon, which you can make out by looking at the connection of these two things with the diencephalon, thalamus and hypothalamus. So apart from thalamus, hypo, meta, epi, subthalamus, I can also add optic stalk to this. Optic stalk, and as I said, what optic stalk will give rise to? It will give rise to optic nerve and retina. Retina also, remember that. If somebody asks you retina is derived from which part of neural tube, then you have to go with diencephalon in that. So optic stalk, and lastly also the neurohypophysis. Neurohypophysis, posterior pituitary. See, posterior pituitary or neurohypophysis comes from the extension, it is coming an extension from the diencephalon. Whereas adenohypophysis or anterior pituitary will go as an extension from the surface ectoderm, and I hope you know about this, that is called as Rathke's pouch. So Rathke's pouch is the one which forms the adenohypophysis, and the neurohypophysis, it is an extension coming from the neural tube from the diencephalon part. Then comes the meson, meton and myelencephalon, which in that sequence are telling you about the brainstem. So guys, mesencephalon will give rise to the midbrain, metencephalon to the pons, and myelencephalon will give rise to the medulla oblongata. So midbrain, pons and medulla oblongata, in that sequence, meson, meton, myelencephalon. The only major part which is remaining here is the cerebellum. Now cerebellum should be coming from where? Now think of the gross anatomy of the CNS, and you will see that cerebellum are placed behind the pons. If you see the picture, cerebellum are placed behind the pons only. So pons is derived from where? From the metencephalon, and the same part will also give rise to the cerebellum. So both pons and cerebellum are derived from the metencephalon. So these are the derivatives coming from the secondary brain vesicles. As I said, they might ask you a question directly from the primary brain vesicle also, you know the lineage. Okay. Now another important thing is, obviously that's a neural tube giving rise to all these things. So we have a space inside, and space inside the neural tube will give rise to the ventricles of the brain. So what ventricle is where? Having a gross idea about it will also fetch you the answer from here itself. Like if I say lateral ventricle, where is lateral ventricle present? They are present in the cerebrum. Cerebrum is derived from where? Telencephalon. So I can clearly say that cavity of telencephalon will give rise to the lateral ventricle. Cavity of telencephalon will give rise to the lateral ventricle. Again, where is third ventricle present? Third ventricle is situated between the thalamus. We have lateral boundary of the third ventricle is formed by the thalamus and hypothalamus. And you know both thalamus and hypothalamus are derived from the diencephalon. So obviously the space within the diencephalon will give rise to the third ventricle. Then fourth ventricle, situation of fourth ventricle is between the pons and cerebellum. And we just said pons and cerebellum, they are both derived from the metencephalon. So cavity of the metencephalon will give rise to the fourth ventricle. Cavity of metencephalon give rise to the fourth ventricle mainly, which leads to the question here, cavity of mesencephalon will give rise to what? Now I just put an asterisk sign there. This cavity of mesencephalon is connecting the third ventricle to fourth ventricle. So obviously it is giving rise to the aqueduct of Sylvis. It is giving rise to the cerebral aqueduct or aqueduct of Sylvis. Aqueduct of Sylvis is the cavity of the mesencephalon. So this is a little bit about the brain vesicle and their derivatives. They do ask direct questions from here, and especially about the development of ventricle. And one of the recent question which I remember is about the aqueduct only. The aqueduct is derived from which part of the neural tube. Now continuing with the general part, let's come on to the blood-brain barrier. Blood-brain barrier. The BBB, the blood-brain barrier. Now every time we talk about blood-brain barrier, the first thing which comes to our mind is astrocytes. Astrocytes forms the blood-brain barrier. True, that is correct. but that is forming just one component of the blood-brain barrier and not everything. Now let's say, guys, these are the astrocytes here. These are the foot processes of astrocytes which are covering a blood vessel. So surely astrocyte is one component of blood-brain barrier, but probably not the most important component. Then what you'll see, these processes of the astrocytes are covering the blood vessel. Of course, they're covering the blood vessel. So we have this basement membrane. There is a basement membrane of capillary endothelium. Basement membrane of capillary endothelium. And if this is the endothelial cells we're talking about, if these are the endothelial cells we are looking at, now all these endothelial cells, guys, which are forming the lining for this capillary inside, they are all connected by the junctional complexes. And one of the important junctional complex which we need here is the tight junction, also called as zona occludens. So tight junction, or so-called zona occludens, tight junction or zona occludens between capillary endothelium. So these are overall all the components of the blood-brain barrier. We got an astrocytes. If you go from outside to inside, we got basement membrane of capillary endothelium, and we have tight junction or zona occludens between the capillary endothelium. But if the question is asked to you that which of the following is the most important component of blood-brain barrier or the true blood-brain barrier, then your answer is not astrocyte. You have to go with the tight junction. So please note that tight junction is the one which is regarded as the true blood-brain barrier. If you have to choose between them, this will be your answer. So true blood-brain barrier is your tight junction. Talking about blood-brain barrier, well, obviously blood-brain barrier is present all around the brain, everywhere. But there are certain places where we do not have blood-brain barrier, and what site are those? They do ask this question as well. Now, if you look at all the areas which are devoid of blood-brain barrier, now they have something very unique about their location, that they are present in the circumference of some ventricle only. Either you see them in the circumference of third ventricle, or you see them in the circumference of fourth ventricle. What I'm saying is, if I talk about areas devoid of blood-brain barrier, areas devoid of blood-brain barrier. So in one word, if I have to describe the areas which are devoid of blood-brain barrier, they are present around the ventricle, and that's why they are called as circumventricular organs. Call them circumventricular organs, because of their location. They are around the ventricle. Now let me just quote some examples there. Like area like called as area postrema. We will discuss area postrema when we'll talk about the fourth ventricle. It is present at the inferior, close to the inferior angle of fourth ventricle in the floor. Then we have median eminence. Median eminence. You can just list them down for now because we still have to discuss them along with the ventricle. Median eminence. We got pineal gland. We got neurohypophysis. Neurohypophysis or posterior pituitary, you can say neurohypophysis or posterior pituitary. Subfornical organ. Subfornical organ, and you can add one more example to this, that is OVLT. What OVLT stands for? That is organum vasculosum. Organum vasculosum lamina terminalis. Organum vasculosum lamina terminalis. Again, something to be discussed when we'll talk about the third ventricle, guys. Organum vasculosum lamina terminalis. So you should know this list of the areas which are devoid of blood-brain barrier. If I just given one significance here, like the pineal gland, the hormones coming out of the pineal gland, they have to act on the neurohypophysis. So both are devoid of blood-brain barrier, and that is something which is facilitating it. And there are certain drugs also which are designed which will act exactly at those areas where the blood-brain barrier is not present, and they can always enter inside using one of these areas, like area postrema. So this is called as these are the list of areas which are not having the blood-brain barrier, and because all of them, every single one of them is having some relation or present in the periphery of the ventricle, third or fourth ventricle, so we call them circumventricular organ. Circumventricular organ. Now guys, talking of devoid, there are some areas in the brain which are also devoid of nociceptive fiber or pain fibers. Now we do not have pain fibers in majority of the part, to be honest. So areas devoid of pain fibers areas which are devoid of pain fibers or nociceptive fibers. The easy way to remember the mnemonic for that would be BED, B-E-D, BED, PAC, P-A-C, BED PAC, BED PAC. Well, B is for this brain parenchyma, the brain parenchyma. E stands for ependyma. What is ependyma? You know, ependyma is ventricular lining epithelium. If you look at the central canal or lateral or third, any ventricle, they have a particular type of lining epithelium, and that lining epithelium is called as ependyma. So the ependyma. D stands for dura mater, which may come as a controversy to your mind. I'll tell you. Let me write that first. Dura mater, pia mater, arachnoid mater, and C is for the choroid plexus. Choroid plexus. Now, if you remember, when we're talking about the dura mater and dural venous sinuses in the head and neck part, then we said dura mater is something which is having pain fibers. Remember, it was supplied by the trigeminal nerve, 7th, 9th, 10th, and cervical nerves also. There's so many nerves supplying the dura mater. So obviously, there must be pain fibers present in the dura mater. And now I'm writing dura mater in the list which is devoid of pain fiber. Well, there's a little catch here, and the catch is that dura mater, which is neither covering any blood vessel nor contributing to the formation of any dural venous sinus, is devoid of pain fiber. So we do have pain fibers in the entire dura mater, but at those points where dura mater is covering what? It is covering the blood vessel and it is covering the dural venous sinus. So we have pain fibers there. Apart from it, the dura apart from it is devoid of the pain fiber. So dura, with the area which is devoid of pain fiber, we said dura mater, which is neither covering blood vessel. Like dura mater must be covering so many arteries: middle meningeal artery, some branches of internal carotid artery, accessory meningeal artery. So the dura mater which is neither covering a blood vessel nor contributing to dural venous sinus. Like we know that the endostel layer and the meningeal layer, they will separate and they form the dural sinuses. So wherever you have dural venous sinus, we have pain fibers there. Wherever we have middle meningeal, accessory meningeal, or any artery which is covered with dura mater, you do have pain fiber there. But apart from that, the rest of the dura mater is devoid of it. So yes, dura is devoid of pain fiber only in those places where it do not contribute to the dural venous sinus or it covers the blood vessel. We have already discussed the dura mater and head and neck in detail, the cranial dura mater and the dural venous sinuses. Now let's talk about the other meninges. So we're going to talk about the arachnoid mater first, and we'll talk about the pia mater with respect to spinal cord only, because it is more important when it talk about the spinal cord part. So let's start our discussion with the arachnoid mater. Continuing with the general part here, let's now pay attention to the arachnoid mater. Okay. Now, what you see, guys, if I just go back to the dura part here, so we said we have two layers of the dura mater. There is an endostel layer of the dura, and here is the meningeal layer. And of course, in between, we got this dural venous sinus. If I mark this as devious, that is dural venous sinus present between the endosteal and the meningeal layer of dura mater. That is dura mater you're looking at. The next one, or the deeper one to it, is the arachnoid. So there we go. Let's say this is arachnoid. Now what you see, this arachnoid matter is sending extensions inside the dural venous sinuses. It is sending off these extensions inside the dural venous sinuses that you will see throughout these dural venous sinus. So yes, the deeper layer is arachnoid, but arachnoid matter is sending the extension inside. That is arachnoid matter. And these extensions are called as arachnoidal villi. Of course, these are the finger-like projections, so we call them arachnoidal villi. These are referred as arachnoidal villi. Now, generally we say, guys, what is the function of arachnoidal villi? We simply say they for the absorption of the CSF. But does this word absorption sounds right? Well, it doesn't, because absorption of CSF means something like taking inside. CSF is already present here. If I look into this picture here, CSF is where already in the subarachnoid space. CSF runs in the subarachnoid space. As a matter of fact, the components of CSF are dissolved into the dural venous sinus through these arachnoidal villi. So you will be seeing the CSF being drained into the dural venous sinus through the arachnoidal villi. So when you say the word absorption of CSF is done by the arachnoidal villi, that actually doesn't sound right. So it's basically kind of dissolving the CSF or allowing the CSF to, or the component of CSF to mix up with the dural venous sinus blood. Now these villi, when you say the word villi, obviously villi are the finger-like projections. So if I draw it like this, these are the arachnoidal villi. But what happens with increasing age, many arachnoidal villi, they come close to each other and they form a granular mass which is called as arachnoidal granulation. So with age, what will happen? They get old and they get clustered. These arachnoidal villi, as they get old, they also get clustered and they give rise to these granular mass. So like multiple arachnoidal villi will meet and will give rise to a granular mass like this, and that is what you call as the arachnoidal granulation. This is what you call as the arachnoidal granulation. Arachnoidal granulation. And one thing that you should know about the arachnoidal granulation, that majority of the arachnoidal granulation, they're present along superior sagittal sinus. This is such an important information here, that majority of the arachnoidal granulation, not all of them, but yeah, most of them, most of the arachnoidal granulation are present here along the superior sagittal sinus. Why this information is important? Because if arachnoidal granulation are present mainly along the superior sagittal sinus, that means the maximum absorption of CSF also takes place where? In the superior sagittal sinus, right? Which also tells me that if somebody is having a meningioma which is originating from the arachnoid, so the chances of that meningioma is also where? In the superior sagittal sinus. So knowing that the arachnoidal granulations are mainly present in the superior sagittal sinus gives us two more information here. One, that maximum CSF absorption, takes place where? In superior sagittal sinus. And number two, the meningioma which are of arachnoid origin. We're talking about particularly those arachnoid meningioma of arachnoid origin are also seen along superior sagittal sinus. They're also seen mainly along the superior sagittal sinus. So that's an information we extracted by knowing that many arachnoidal villi, they will aggregate together and they form the arachnoidal granulation which are present in the superior sagittal sinus, which also means that maximum villi are also present in the superior sagittal sinus only. Now guys, when you talk about the arachnoid matter, we already said CSF is present in the subarachnoid space. Now, do we have anything else apart from CSF in the subarachnoid space? Well, we do. most of the blood vessels of the brain, like we see the branches of not only arteries, even veins also, vessels I should say. So most of the vessels of the central nervous system, they are running in the subarachnoid space before they enter into the parenchyma of the brain. Like if I talk about vertebral artery, posterior inferior cerebellar artery, basilar artery, posterior cerebral artery, and their branches, they're first running, it looks like they're running on the surface of the brain. But where exactly they're running on the surface? They are running superficial to pia mater, but deep to arachnoid matter. That means in the subarachnoid space. And that is why when a blood vessel goes inside the brain, it will push the pia mater along with it. Now imagine if this is a pia mater here. If this is if let's say this tissue is a pia mater here, and here is a brain which is covered by it, and we have a blood vessel which is running in this. So that's a subarachnoid space. We have arachnoid matter. This is the blood vessel. This is pia mater. So when this blood vessel has to go inside, so what will happen? This will take this pia mater along with it like this, and that will make a sleeve of pia mater present around the blood vessel. So when you see the blood vessels entering inside in the core of in the parenchymatic part of the brain, then you will see they have a sleeve of pia mater which is covering them. So let's talk about the major subarachnoid spaces. And well, we do have subarachnoid space present everywhere around the entire brain and the brain stem. But at some places, you will see that these subarachnoid spaces are larger than usual. And that's why we call them cisterns, subarachnoid cisterns. The larger than usual subarachnoid spaces are called as subarachnoid cisterns. And obviously, these subarachnoid cisterns will be housing CSF. Of course, there is no doubt about it. There will be CSF. And apart from it, there must be some important blood vessel present in them. Let's talk about it. So guys, subarachnoid, we said what? Cisterns. So these are nothing but the large subarachnoid spaces. These are large subarachnoid spaces. These subarachnoid cisterns are the large subarachnoid spaces. Well, there are so many cisterns we have. I mean, there are some minor and major cisterns, but when we talk about the major cisterns, there are 5 of them. And 4 can be seen when you take a sagittal section of the brain. If I take a sagittal section of the brain and spinal cord, from the side, I can appreciate 4 of them. One is seen from the outer aspect, can be seen from the superolateral surface of the brain. So let me take a sagittal section which is passing from the corpus callosum. So here we go, guys. Let's say this here is the corpus callosum, which is connecting the 2 cerebral hemisphere, right? And let's say if we go further downward, there is a brainstem. So we got a midbrain there, we got a pons, and we have medulla oblongata. So I just mark them. These are, let's say, 3 part of the brainstem we are looking at. We got a midbrain. This is pons, and this here is medulla oblongata. We already discussed what is the location of cerebellum. You see the cerebellum is predominantly present behind the pons. I mean, it is expanded backward, so it looks like it is covering the midbrain and medulla also. But yeah, when you see from the attachment point of view or development point of view, cerebellum was derived from the same metencephalon, which is giving rise to pons. So just make sure when you draw the cerebellum, it should be mainly behind the pons. And of course, the ventricle that we got inside here, that is the 4th ventricle. The ventricle that we have between the pons and cerebellum, you already know this ventricle here is the 4th ventricle. So that's the overall the sagittal section we're talking about. Okay. Now, let's imagine that this black line here is representing the pia mater. The pia mater is the most faithful layer of the brain, goes along with every gyri, every sulci. So it is kind of adherent to the brain only. That is the pia mater. And then obviously outside pia mater will be arachnoid. Arachnoid is also running mainly with the curvatures of the brain. But as I said, at some places you will see arachnoid matter is jumping from one elevation to another elevation, and that leaves a space in underneath it, which is called as a cistern, subarachnoid cistern. So if, let's say, guys, this here is the arachnoid matter, So you'll see it is, we have a large space in front of the midbrain. Look at that, the one which I've I made it larger here. We got a relatively larger space in front of the pons. Then we have a big space which is present above the cerebellum. So we have one cistern which is present above the cerebellum. And the largest cistern is the one which is present below the cerebellum. The one which is below the cerebellum. Let me highlight these cisterns for you first before we talk about them. So we got one cistern that you see which is present in front here, in front of the midbrain. There's the one. Another major cistern is the one which is in front of the basilar sulcus of pons. So you simply say in front of pons. The largest one is to be seen below the cerebellum. Below the cerebellum, behind medulla. And then we have another cistern which is present in this part, which is between the pons and cerebellum. Between the, not pons and cerebellum, sorry, between cerebellum and the corpus callosum. Now what cisterns are these? Let's name them first. Now this here guys, this cistern, let's start with the largest one, is called as cisterna magna. It's a big cistern, so we call it cisterna magna. This is the cisterna magna. Either you call it cisterna magna or you can even call it cerebello-medullary cistern. You can see it is situated between the lower part of the cerebellum and medulla. So we call it cerebello-medullary cistern. So cisterna magna or cerebello-medullary cistern. And what is there in this cerebello-medullary cistern if I write their content here itself? Well, of course, CSF will be there. I don't have to write that. The content of the cerebello-medullary cistern, we have vertebral artery. We have a part of vertebral artery in it. Vertebral artery, and also an important branch coming from vertebral artery, that is pica, posterior inferior cerebellar artery. We'll be discussing these arteries later on. So vertebral artery, a part of vertebral artery, not entirely, and then posterior inferior cerebellar artery, the two major blood vessels which you will see present in the cisterna magna. And you know what is the special feature of the cisterna magna is, one, obviously it is a larger cistern, and the location of the cistern is closest to the foramen magnum. If I have to draw the foramen magnum here, that's how it will be, because we know that lower part of medulla oblongata, it goes out of the foramen magnum. So let's say this here is the foramen magnum. So the cistern is in very close relation to the foramen magnum. That's why if we have to do cisternal puncture, well, obviously lumbar puncture is the one which is always preferred. But if for any reason, if there is a spinal cord stenosis or there is a tumor or any reason that you have to do the cisternal puncture only, then the only cistern of choice will be the cisterna magna, because that's a cistern which you can reach. You have to insert a needle from the posterior side, from below the foramen magnum obliquely upward, and that's how you can take out the CSF from there. So if the cisternal puncture has to be done, it has to be done from cisterna magna. Although never a safe procedure to be done, because we have brainstem present in front, which is having the respiratory and the cardiovascular areas in it. But because this cisterna magna, as I said, this cisterna magna is closest to foramen magnum, one important thing. Number two, it is largest also. It's the largest cistern. So for both these reasons, it is used for cistern, can be used for cisternal puncture. Can be used for the cisternal puncture. So that's about the cisterna magna or cerebello-medullary cistern, having vertebral artery and the posterior inferior cerebellar artery present in it, the two very important blood vessels, situated very close to medulla oblongata. That's why it is approachable from outside, and it can be used for the cisternal puncture. Then next in the line, the cistern which is present above the cerebellum. So we simply call it superior cistern. This cistern is at the top, so we call it superior cistern. Either you call it superior cistern, or see this cistern is present behind the midbrain. If you look carefully at this diagram, the cistern is situated behind the midbrain. And guys, dorsal aspect of midbrain is having superior colliculus and inferior colliculus. Again, something we have discussed that in the head and neck part. that we have third nucleus at superior colliculus, fourth nucleus at inferior colliculus. So both these colliculus, so we have two superior colliculus and two inferior colliculus. So that means total 4 colliculus will be there, and all of them are projecting backwards toward the cistern. That's why the cistern is also called as quadrigeminal cistern. So we have 4 gem-like structure, 4 colliculus are presented there. So superior cistern, or also called as a quadrigeminal, also called as the quadrigeminal cistern. So first was the magna, the cerebellomedullary cistern, and now we are looking at a superior cistern, also called as a quadrigeminal cistern, which is actually in continuation to the ambient cistern. And what is there in the cistern? Again, this is something we discussed in the cranial durameter only. When we talked about the straight sinus, guys, we said straight sinus is a continuation of a vein coming from the brain, and that vein was great cerebral vein or vein of Galen. So that vein will be seen in there. That is called as a great cerebral vein or vein of Galen. Great cerebral vein, also called as vein of Galen. Where exactly this vein of Galen is, we will be discussing that in the blood supply part of the brain. But as of now, just write the content. We'll go to the anterior part. Now we saw the 2 cisterns present behind the brainstem, one above the cerebellum, one below the cerebellum. Now when you go in the posterior part, there's a cistern present in front of the pons. So we simply call it pontine cistern. This is called as a pontine cistern. Pontine cistern or cisterna pontis, whatever you call it. Pontine or cisterna pontis. And what we expect to see in the pontine cistern is, now we know that vertebral artery will be coming forward like this, and the vertebral arteries are the one which will fuse or join with each other, and they will give rise to the basilar artery. And that basilar artery is the one which you see running in the basilar sulcus, present right in front of the pons. So the main content of the pontine cistern is the basilar artery. The basilar artery. Now obviously, if you have branches of basilar artery, like we have the branches like posterior, superior, we have superior cerebellar artery, we have anterior inferior cerebellar artery, we have direct pontine branches. So obviously initial part of those arteries will also be seen in that cistern, and then they were moving outward. But you got to remember the major content here. Basilar artery is there, so obviously the beginning of the branches of the basilar artery will also be there in the pontine cistern. And finally, coming to the cistern present in front of the midbrain. Now first I wanted to understand the name of this cistern and why it is called so. If you remember, guys, again in the head and neck part, when we talked about the cranial nerve and we talked about the third and the fourth nerve, we said they are coming from the midbrain. So we drew the midbrain something like this, right? So we have a colliculus present at the back. That was a colliculus part, superior inferior colliculus. And I hope you remember, these were called as the cerebral peduncles. These elevations of this is a midbrain here. These elevations were called as cerebral peduncles. These are called as the cerebral peduncles. And we also said that the fossa in between is called as interpeduncular fossa. There is a fossa in between called as interpeduncular fossa. Now if I cover it with the arachnoid matter, what you will see, arachnoid matter will be running all around this midbrain and will be jumping from one peduncle directly to the other peduncle in this manner. And that's how it leaves a space between the two peduncle, and that's why it is called as interpeduncular cistern. So if you remove the meninges, we still have fossa there. We still have interpeduncular fossa present over there. But when you put the meninges over there, we also have a subarachnoid space exactly in that fossa, and that is called as interpeduncular. It is between the two peduncle, so we call it interpeduncular fossa, which you are seeing right now in this diagram in the sagittal section. It's right in front of the midbrain. In the middle part of the midbrain, it is there in front. So that's the same thing that you see in the transverse section between the two cerebral peduncle, is called as interpeduncular cistern, I should say now. Interpeduncular cistern, which is in the fossa. What we expect to see in the interpeduncular cistern, apart from apart from CSF? Well, basilar artery, now it goes. Now imagine the basilar artery is going above here, and we know that basilar artery divides into posterior cerebral artery, and this posterior cerebral artery is joined by the posterior communicating artery. And posterior cerebral artery, this communicating artery, they are all part of what? They are all part of the circle of Willis. So not entire circle of Willis, the posterior part of circle of Willis will be seen in it. So when I say interpeduncular cistern, it is having PCA in it, it is having posterior communicating artery in it. So overall I can say that the content involves the posterior part of circle of Willis. Posterior part of, I'm writing COW, circle of Willis. Posterior cerebral artery and posterior communicating artery, they are contributing, they are forming the posterior part of the circle of Willis, and that is what we have in this cistern. The cistern is called as interpeduncular cistern. So these are the four major cisterns, guys, which we appreciated in the sagittal section. One above the cerebellum, one below the cerebellum, that is a magna, and in front of the brainstem we see one in the front of the midbrain or in between the two peduncle called as interpeduncular, having circle of Willis, and the one below that in front of pons is called as a pontine cistern or cisterna pontis, having basilar artery. But we said there is one more major cistern that you should know about, and that is present on the superior lateral surface of the brain. So when you see the superior lateral surface of the brain, the two major sulcus that you should know at this point of time, if this is the superior lateral surface of the brain, so we have one sulcus that is called as the central sulcus. I'm not drawing that for now. And the sulcus that you're looking at right now, guys, this sulcus here is called as a Sylvian sulcus. This sulcus is called as a Sylvian sulcus or lateral sulcus, you can say. Sylvian sulcus or lateral sulcus. And exactly in this Sylvian or lateral sulcus, we also have subarachnoid space present along with it. And that subarachnoid space along the Sylvian sulcus is holding the middle cerebral artery, which is a major artery supplying the superior lateral surface of the brain. So guys, the cistern that you see along the Sylvian sulcus is called as Sylvian cistern. It is called as Sylvian cistern, or also called as cistern of lateral sulcus. Cistern of lateral sulcus. And yes, the content will be what? Middle cerebral artery. Middle cerebral artery is the content there. Middle cerebral artery is the content. So these are the five cisterns, guys, that you should know about. Interpeduncular, pontis, superior cistern, that is, you can say quadrigeminal cistern, and then we have inferior one, that is cisterna magna, and on the outer aspect, the Sylvian cistern, also called as cistern of lateral sulcus, holding middle cerebral artery. So this concludes the general part here, and in the next section from there on we start talking about the spinal cord. First we'll look into the morphology of the spinal cord, and then obviously about the tracts also.